Hello again, everyone. My name is Marty Guthmiller. I am CEO at Orange City Area Health System, bringing to you a special edition of the COVID-19 community briefing. It's special because it's our 40th edition today, and in honor of this, we are actually celebrating. So we have a cupcake with not 40 candles, but one. So our 40th edition today of the COVID-19 community briefings. As has become our practice, I will not be sharing a local scoreboard today. We will do that weekly every Monday, and so you can look forward to that if that is of interest to you. So we're going to jump right in with some updated stats, and I'm going to talk a little bit more about maybe why I say what I say and how I interpret some things going on. So here we are. First of all, though, the stats. Sioux County has had 551 positives at this point of 3,625 tested. That is a 15.2% positive rate. While that rate is still high, it is trending down in the right direction. Down is the right direction, but not very fast. If you go back, counting this as our fifth time, you go back from 5, 4, 3, 2, 1, you're going 15.9, 15.6, 15.5, 15.4, and today 15.2. So we're trending down, trending in the right direction, but very slow, and it's still a fairly high positive rate at 15.2. But again, trending in the right direction, which means our rate occurring is less than that currently. Stepping up to Region 3, we have 33 currently hospitalized in Region 3, which again, by now you know is the 20 counties in Northwest Iowa. That is the same number as we reported on Monday. And the time before that, we were at 31. So that's been fairly consistent as of late. We've had 2 patients admitted in the last 24 hours, and we currently have 12 people in the ICU in Region 3. That number when we spoke last was 14. So from Region 3, kind of saying, we're holding serve at this point, kind of stable. Iowa, however, is a little different story. A lot of hospitalizations are a different story. We'll get to that in just a second. Iowa, though, has 40,960 positive cases, so almost 41,000, out of 441,256 tests. That rate is 9.3%. So as a state, we're at 9.3. As a county, we're at 15.2. The 9.3 is a number that was the same as last Monday, but the 4 times previous to that, the state was at 9.4. And when I say previous to that, meaning that our 4 last briefings prior to that, we're all at 9.4. So again, if it's trending in the right direction, but really pretty flat. A number that's not flat is our hospitalizations. Unfortunately, that is going up on a statewide basis. At 213, that represents an increase from the previous time we talked at 195, time before that 182, the time before that 169, and the time before that 157. So we're going 157, 169, 182, 195 to 213 today. That's not a good thing. But fortunately, not a lot of those are in this area. But this brings up a point that I'd like to talk a little bit about. Is remember the 2 things that I've really valued in this, or how I look at these numbers and kind of the degree of severity, the degree of attention we need to pay to them, are really 2 things. The positive rate, we look and pay a lot of attention to that, and the number of hospitalizations. Those are the 2 metrics that I personally use to gauge my actions within the health system and, quite frankly, personally. I do not use deaths as a gauge on that. I do report and talk about deaths, but it is not in the context of it's the only stat that I look at. Quite frankly, I report on deaths to make sure that folks understand that this isn't over. This needs to be taken seriously. We need to continue all of our social distancing, those kinds of things, but it's not one of the key metrics that I rely on, and it's certainly not the only number that we report on. I'm going to follow up a little bit to the red zone information that came out last week through various channels. If you remember, and as a follow-up, this was an unissued White House task force report that, to my knowledge, has still not been acknowledged by the CDC, Iowa Department of Public Health, or Governor Reynolds' office, to my knowledge. While I understand the metrics of the calculation, what I was expressing was I don't understand how it is relative to our market, or probably better said, I don't see that being manifested on the ground in terms of how we are caring for patients, or how the cases that we're seeing, particularly in Orange City, that doesn't seem to make sense to me that we would be classified in a red zone from what I see and what we're experiencing locally. That was my intent of that, not to discredit the report, but to talk about the fact that when you look at a metric such as that was, it was from like a week or so period of time, you can really come to a lot of different conclusions. You can make statistics prove a lot of different points. And so that's what I understand, or what I was trying to communicate last week. I know how it was calculated, but I just don't agree with how it's applied to this market. An example of that is, what seems more sensational to you? The hospitalizations in Sioux County have increased by 50% since the last time we talked, since Monday, a 50% increase in the hospitalizations. Does that sound more sensationalized than it went from 2 to 3? Because that's what it did. Sioux County currently has 3 hospitalized COVID-19 patients. So I'm just cautioning again, both statements are true. It went up 50%, but that's manifested in 1 additional patient from 2 to 3. So be very careful how you interpret statistics and look beyond the headlines and dig into the data a little bit. So I'll get off my pedestal. All right, Sioux County, 3. Of the 213, Plymouth County has 1. O'Brien County has 1. Lyon County has 1. Oh, I'm sorry, Lyon County had 2. Osceola, 0. Clay, 0. Dickinson, 1. Buena Vista County, 0. The trumpets are sounding in BV County. That's been a long time. It's been a tough road for them, but they're currently at 0 patients in the hospital. Woodbury County is at 10. They were 13. Polk County is 51. They were 37, so a pretty big jump in Polk County. So when I talk about Plymouth, O'Brien, Lyon, Osceola, Clay, Dickinson, we're doing the 1, the 2, the 0 kind of thing. Again, Osceola County was one of those counties listed as a red zone. They still have 0 hospitalized patients. Again, that metric doesn't seem to line up. However, there is a lot more activity going on across the state. There's no question about that. There are now 6 counties at 10 or more hospitalized patients. That was 5 on Monday. So there is an uptick, definitely fairly modest in the counties immediately around us and in Sioux County. But the increase seems to be a little bit further away from us at this point. Now, I'm going to talk about deaths next. Again, it is not the only metric that I'm talking about, but it is an important one. it further illustrates that we're not out of this thing. The marathon continues. We're still in the 20 to 21 mile mark. And the deaths have gone up. We're at 820 deaths. That's 27 deaths just this week since Monday. We've learned today that there has occurred the first death of somebody attributed to Sioux County. And so Sioux County now has one death officially recorded. One of the things I want to shift into now, and as I close, is I really do want you all to live your life, and would seriously recommend you to live your life. Now, again, I'm not being flippant about this at all. I'm not saying don't mask, don't social distance. But what I am saying and recommending is don't live your life in fear. You can choose to do that if you want, but I'm recommending that you don't, that you live your life applying common sense, like we've discussed. Well, what does that mean? Again, as we've discussed, social distance when you can. When you can't, please mask. Very important. Wash your hands. Use proper hand hygiene. Use hand disinfectant. Use common sense, and apply common sense and apply these measures to you. But please do not live your lives in fear. We just have to keep going. We have to move on. But again, we don't do that irresponsibly. All right. So that's my message for today. Use common sense. I'm standing by it. Practice good hygiene across the board. Live a grace-filled life. Get to know your neighbors again. Go to baseball games, but practice those social distancing measures that are going to be best for all of us. A lot of stuff coming up with schools opening and all that kind of stuff, sports starting. We need to act responsibly, but we need to get on with things too. So as we close today, the special 40th edition of our community briefing, we remind you to stay vigilant, stay strong, and of course, we wish you all good health. Stay healthy, everyone. Thank you.